Welcome back to the Elevator Project. I'm Dr. Marino, and today we're talking about something that can completely change how you advocate for your health: your labs. Not just the black and white numbers that are printed on a portal, not just you're fine, but what those labs actually mean for your energy, your hormones, your metabolism, your hair, your mood, your fertility, and your long term health. Here's the truth: most women are handed lab results with zero explanation. Worse, their symptoms are dismissed because the labs aren't flagged red. But not flagged does not mean optimal. And that distinction changes everything. So today I'm walking you through the most important labs every woman over 25 should know, what they actually measure, why they matter, and how optimal ranges differ from standard lab ranges. So if you've ever been told everything looks normal, but you feel foggy, inflamed, exhausted, anxious, or stuck, this episode is for you. So let's get into it. Before we go into specific labs, we need to talk about something important. Why are so many women confused by their results in the first place? There are three reasons. First, lab reference ranges as statistical, not optimal. Reference ranges are created by averaging large populations, but that population includes people who are sleep deprived, metabolically unhealthy, sedentary, nutrient deficient. So normal simply means common, not necessarily ideal for feeling well. Second, many lab markers change long before disease develops. Medicine often waits for disease thresholds, but your body starts giving you signals years earlier. So the fatigue, the hair loss, the brain fog, the cycle changes, the weight resistance, these symptoms often appear long before a lab crosses the disease line. And third, most visits are time limited. A typical doctor visit is about 10 to 15 minutes, and in that time, we're addressing symptoms, medication, documentation, insurance requirements, and follow-ups. So labs get summarized quickly as everything looks normal. But that doesn't mean that there isn't more context, and that's what I want women to understand. I'll start with your thyroid panel. Your thyroid is your metabolic command center. It regulates your metabolism, your body temperature, your heart rate, your hair growth, your mood, your menstrual cycle, your ovulation, your fertility. So every subtle dysfunction can cause significant symptoms. What most doctors check is just the TSH, when what women actually need is your TSH, your free T4, your free T3. So I'm just going to break this down simply. TSH is the brain's signal to the thyroid. Free T4 is the storage hormone, and free T3 is the active hormone. And that's the one that actually enters your cells and drives metabolism. So this is where women tend to get dismissed. Standard normal TSH range is about 0.4 to 4.5 MIU per liter, milli international units per liter. But many women feel symptomatic above 2.5. So truly the optimal range based on symptoms appearance is a TSH of 0.8 to 2.0, with a free T4 in the mid to upper range of normal and a free T3 in the upper 50 to 75% of the reference range. And why is that? Because you can have a TSH of 3.8, which is technically normal, and still experience weight gain, fatigue, hair thinning, anxiety, irregular cycle, cold intolerance, brain fog. And the reason is because your free T3, the active hormone, may be low even in the setting of that normal TSH. Because if the T3 isn't converting properly, your cells are essentially running on low battery mode. So when women are told you're fine, technically what they should be saying is you're within that statistical range. And that's different. And the one thing I want women to understand about thyroid health is the conversion. Your thyroid mostly will produce T4, which I referred earlier as your storage hormone. But your body has to convert T4 into T3, which is your active hormone, and that conversion happens in your liver, in your gut, in the peripheral tissue. And several things can impair that conversion, such as chronic stress, inflammation, low iron, insulin resistance, or gut dysfunction. So you might have a normal T4 level, but if the conversion to T3 is poor, you'll still feel like you have hypothyroidism. And that's why symptoms matter. So when someone says that they have fatigue, hair thinning, cold intolerance, constipation, brain fog, I'm not going to just look at their TSH. I want to understand the whole thyroid picture because thyroid doesn't operate in isolation. It is deeply connected to the metabolism, to the stress hormone, and to the nutrient status. Now, iron deficiency is one of the most underdiagnosed issues in women, especially in the menstruating woman. Iron will impact your energy, your oxygen delivery, your exercise tolerance, that thyroid conversion that we just talked about, your hair growth, your mood, your fertility. But here's the mistake. Frequently, your doctors will check your hemoglobin and say you're not anemic. But anemia is a late stage iron deficiency. So what you actually need is a full iron panel when we check not only your serum iron, your TIBC, your transferrin saturation, and your ferritin. And your ferritin is your storage tank. So a normal ferritin per the lab standard is often 10 to 150 nanogram per milliliter. But let me say this clearly, a ferritin of 12 is not optimal. It's survival level at that point. The optimal range that I've found for women when it comes to ferritin is usually 50 to 150 nanogram per milliliter. So anytime I see a woman with a ferritin under 40, frequently they're experiencing severe fatigue, shortness of breath, hair shedding, brain fog and anxiety, and also POTS-like symptoms. And they're told your iron is fine. And that is why education matters. So a real world scenario that I often see, a woman in her early 30s come in complaining of exhaustion, feeling short of breath when she exercises, and she has difficulty concentrating. Her hemoglobin is normal and she's told she's not anemic. And when I check her iron panel and I see her ferritin is at 18. So her iron storage tank is nearly empty. So her body is essentially running on reserve fuel at that point. Once her ferritin is restored to a healthier range, like around the 60s to the 80s, very frequently we'll notice improved energy, less hair shedding, improved exercise tolerance, and clearer thinking. And that is why ferritin matters so much. One of the big lab values that we get checked and very frequently don't even understand the result is our A1C and our fasting insulin. Insulin is one of the most powerful hormones in the body. Its job is to move glucose from the bloodstream into cells, but when your insulin stays elevated over time, it just tells your body to start storing energy. And how does it store the energy? Primarily as fat. Chronically elevated insulin can lead to weight gain, especially around the belly, increased hunger, sugar cravings, and afternoon energy crashes. So something that many women don't realize is that your insulin will also interact with the ovaries. Higher insulin level will stimulate the ovarian testosterone production. And that's one of the reasons why insulin resistance is strongly related to PCOS. So when we address insulin health, we're not just talking about your blood sugar. We're talking about your hormone balance, we're talking about your fertility, and your long term metabolic health. So, the earlier a woman understands the importance of your insulin, the more control they have over their health trajectory. This is pretty critical. A1C only measures your average blood sugar over 3 months. And the other problem is that A1C will rise late. Insulin will rise years before the A1C does. So if you only wait for your A1C to rise, basically you're catching that dysfunction at its late stage. Optimally, you want your insulin to be 2 to 6 microinternational units per ml and your A1C to be 5 to 5.4%. The normal for the A1C can go all the way up to 5.6 or 5.7, but very frequently you start seeing the symptoms earlier. Elevated insulin will drive the stubborn weight gain, the carb craving, the PCOS, infertility, metabolic disease. So, high insulin is not just about diabetes, it's about the hormonal chaos. Insulin will influence the ovarian function. It also influences your testosterone. It influences your fat storage. And if you're struggling with weight resistance despite doing everything right, you might want to check your insulin because that might be the missing piece. Next blood work that I want to talk about is your lipid panel. Women are often told LDL is everything. That's your bad cholesterol. I want you today to put that into context because when you're looking at the lipid panel, we look at your HDL, which is your protective cholesterol, your triglyceride, your LDL, and your total cholesterol. Optimally, you want that HDL to be above 60 milligram per deciliter. Your triglyceride, the goal is for it to be less than 100. The triglyceride to HDL ratio, which is something that is frequently overlooked, you want that to be under 2 because that ratio is a powerful metabolic marker. If your triglycerides are high and your HDL is low, that often reflects insulin resistance, even if your LDL is not in the extreme range of abnormality. Early identification here is going to be what prevents the long-term cardiovascular disease, which is the number one killer of women. It's not breast cancer, it's heart disease. So prevention starts in your 20s and in your 30s, ideally. Do not wait until you're in your 60s. And something I want to clarify about cholesterol is that it is often misunderstood. Cholesterol itself is not harmful. Cholesterol itself is not the problem. Your body actually needs cholesterol because it uses that to produce your estrogen, your progesterone, your cortisol, your vitamin D. So the question isn't simply whether cholesterol exists. The question is how your body is processing that energy and fats overall. So, for example, when you have a high triglyceride, it often reflects an excess in carbohydrate intake or an insulin resistance. Your low HDL may reflect inflammation, poor metabolic health, or a sedentary lifestyle. So instead of focusing on one isolated number, I want us to look at the pattern because the pattern is what will tell the metabolic story. I also highly recommend for women to check their vitamin D and their vitamin B12. Vitamin D is a hormone. It's not just a vitamin. It impacts your immune function, your mood, your fertility, bone density, inflammation. And the lab normally often starts at 30, so 30 being normal. But optimally, I would say 50 to 80 nanogram per milliliter being a normal level for your vitamin D. Women who have their vitamin D under 40 frequently are reporting that they're fatigued, they feel depressed, they get sick or they get cold frequently, like their immune system is very weak, and they feel like their muscles are weak. So Again, ideally, keep your vitamin D above 50. Not only you can do that with vitamin D supplements, but also sun exposure. Of course, you want to take into account skin protection as well. Vitamin B12, the normal starts around 200. But I'll tell you that neurological symptoms will start appearing anytime you hit under 400. So optimally, I usually like for my patients B12 to be about 500. So when their B12 is low, they'll tell me they have no energy, they're fatigued, they have anxiety, memory issues, their moods are unstable, and sometimes they report pins and needles on their feet or their hands, like neuropathy. They're dizzy and feel unsteady. And that is very frequent in women who are either on metformin, or they're on birth control, they take acid blockers, they're on a plant-based diet, and that all has to do with how B12 gets absorbed. So ideally, optimal range, always aim for your B12 to be over 500. And if you're experiencing any of these symptoms, especially the neurological presentation, just ask your doctor to check your B12. Now, for completion's sake, when I talk about blood work, of course, I would recommend, and I always say, to check your CMP and your CBC. Those are foundational panels. Your CMP will screen your liver enzymes, your kidney functions, your electrolyte, your fasting glucose, and your CBC will screen for anemia, infections, and inflammatory markers. Even subtle elevations in liver enzymes can be a signal of metabolic stress. A mild shift in your white blood cell count can reflect chronic inflammation. There are early warning systems, but obviously only if they're reviewed with intention. When we look at those two levels, your CBC and your CMP, we actually want to use them to screen the things that they're intended to, so that we can see those warning signs and react accordingly. What do I want you guys to ask your doctors? Let's talk about it more practically. If you're reviewing labs with your doctor, instead of asking, are my labs normal, to which the answer, if it is, it's yes or no, try asking, where do these results fall within the reference range? Are any of these values trending over time? So basically looking at where you were, are you going upward? Are you trending downward? How does it change? And basically, how is that trend affecting or influencing the symptoms that you're experiencing? If you're told that you're fine, but you still don't feel fine, always ask if there are additional markers that could provide more context. Could those symptoms be related even if the values aren't flagged? So could they be related to a blood level that is in the normal range but that is in the lower limit, or anything like that? Because these questions will open a conversation rather than shutting one down. And good medicine, I will tell you, it works best when patients are engaged in understanding their health. And this is the main purpose of the ELLEvateHER Project. As a physician, I can tell you that one of the most powerful moments in practice is when a patient truly understands their health data. And that is because when women understand their body, they make different decisions. They prioritize sleep. They move differently. They nourish themselves differently. They stop assuming that exhaustion is just part of being an adult. Education is incredibly empowering, and that's the goal of this platform. Understanding your labs isn't about diagnosing yourself. It's about health literacy. It's about asking better questions. It's about not accepting you're fine when your body is telling you otherwise. Because as women, as people, we deserve the nuance. We deserve the context. We deserve optimal, not just average. If you found this episode to be helpful, here's what I'd love for you to do. First, of course, subscribe to the channel. This platform is dedicated to helping women understand their health in ways that are rarely explained during routine medical visit. Second, please share this video with a friend, a sister, a colleague, because I can almost guarantee that you know a woman who's been told your labs are normal, yet she's still feeling off. And finally, comment below. Tell me which lab marker you've always wondered about, whether that is thyroid, iron, hormones, vitamin levels, because as I'm planning future episodes, I want to be able to go deeper into what is relevant to you, what you want to know. Because the more informed we are, the better decisions we make for our health overall. If you also want my full lab cheat sheet, the optimal range guide, head on to ELLEvateHERproject.com and download the resources. Thank you for being here, and I will see you in the next episode of the ELLEvateHER Project.